With more than 230,000 vaccine doses landing in Ontario this week, it still remains unclear how the next priority populations can register for their shots. Today, the health minister promised details would be released soon, but opposition leaders say it is unacceptable that it's almost March and there's so much confusion.
All of our seniors will get the shots if they wish to have one.
But where and when is yet to be determined, and the next priority populations, which includes seniors 80 and older and Indigenous adults, are waiting anxiously for the details.
They're worried and they need information. In fact, even family doctors are worried and they need information.
There are many different ways that this is going to be rolled out, and this is going to be made clear to the people of Ontario in a very short while.
The Ford government has asked each of the province's 34 public health units to come up with their own plan to meet the specific needs of their communities. And doctors agree that after successfully running flu vaccination programs for years, they are the best equipped for the immense task.
They know their constituents best. They know the needs of their communities best. What works in one location might be different from another location. So, for example, your exact rollout strategy north of Kenora might be very different from your strategy in downtown Toronto.
But opposition leaders are criticizing the timing.
It's very weird to me, and I would say incompetent that here we are almost in March, and we are hearing for the first time that public health is now going to take the lead and that there'll be 34 plans across the province.
And what appears to be a lack of guidelines. For instance, the health minister first said she wants all the public health units to roll vaccines out in tandem.
That we won't have a place where one public health unit is immunizing an 80-year-old and another public health unit's immunizing a 50-year-old.
But after a reporter asked if it would be fair to have a smaller region wait for a larger region to complete a phase, she said this.
If we receive a huge supply of vaccines coming in, well, then, of course, they can continue to follow the plan and then go to the next level at their own pace.
The government's goal is to begin vaccinating adults 80 and over by the middle of March. But some critical tools to register have yet to launch, like call-in centers or a web portal to book appointments, which will only launch in English and French to start.
I do have concerns about seniors in particular, people for whom English is not a first language. Trying to navigate this kind of system that is complex and can be confusing might lead to delays.
Of course, some people might not have internet. Some people might not have the capacity to use the telephone system. It really will take a full community effort to ensure that this can be equitably done.
The government says all long-term care home residents who wanted a vaccine have received one, but they're still completing vaccinations for frontline healthcare workers, essential caregivers, and staff at retirement and long-term care homes.